everybody. This is the third part of a 6-part series at the Morris County Chamber that we are calling Perspectives on Senior Living. I can't start off this day without saying, may the 4th be with you and happy Cinco de Mayo tomorrow. All right. The Morris County Chamber, we are here to connect, collaborate, advocate for all our member businesses. Right now, virtually, we're moving into some summertime outdoor programs, and we're excited about that. This particular series is really near and dear to my heart because, as we know, if we educate ourselves prior to a crisis, it's a lot easier because we do it on our time, on our terms, we gather up our information. But as we know, when you're in the middle of a crisis, if your loved one has a medical crisis, that is the hardest time to then start making all these reach out and phone calls. So I'm very excited about this panel. And we could not put these kind of programs together at the Chamber without our volunteer leaders and, of course, our sponsors. So we are very appreciative of our sponsors. And the first sponsor that we're going to hear from today is Boot & Care Center. Sarah is the administrator, and she has some very exciting news to share with us. Take it away, Sarah.
Good afternoon, everyone. Thank you so much, Wendy. May the 4th be with all of you as well. That's one of the many things we're celebrating here at Boot & Care Center as we continue to grow and as we continue to celebrate all the amazing things that people are doing in this world. Tomorrow, we actually start the first of 2 weeks of celebrations for the month of May. Tomorrow, we start celebrating our nurses for Nurses Week. We have a lot of events, we have a lot of giveaways, and it's our way of saying thank you to all that they do, all that they are, and especially from 2020 to 2021, we just want to make it known how much we appreciate all of their accomplishments. The following week is National Skilled Nursing Home Week. So we get to celebrate 2 whole weeks of everybody that works here at Boot & Care Center and all that they've done. We have some fun games. When you pass by us at 199 Powerville Road, starting tonight, you're going to see signs celebrating them. So if you can, honk, say thank you, because we're really happy with all that we're doing. One of the other things we're really happy to celebrate is our CMS has just come out, and our nursing quality measures are a 5-star out of 5-star. It should not go unnoticed, and I am truly proud as their administrator. All of their hard work and all of their time and effort and hearts showcasing who they are, what they've accomplished, and the Medicare system has really and truly stated that. Keep going with the celebration. Memorial Day is at the end of May, of course, May 31st. And even though it's our Director of Nursing's birthday, we are also celebrating our veterans that live here, that have lived with us in the past. And we'll be having a big Memorial Day event here on our grounds, which is 11 acres, but on 3 acres of it, where Boot & Care Center lives and lies. We're going to be having some great things coming to you. So please follow us on Facebook, on Instagram, and on LinkedIn, because we're really happy that we're able to move to the next phase. We are also really happy to celebrate, and we'll be celebrating in the next 2 weeks, that we are 9 weeks free and clear. We are all a little nervous about saying anything else, so we're just happy to say free and clear, because we're testing, we're letting families in, we're letting vendors in. And it was great last week, we let our accordion player come in. And the biggest compliment I got wasn't in words, but was the dance moves are some of our residents and the tears of joy from our families and from our nurses, because it was our new normal, but it was our old normal at the same time. So Boot & Care Center has a lot going on. We have a lot of things that we're celebrating this month of May. All of you are invited to stop by. We'll be putting a list out in the next couple of days of what we're doing. But again, thank you for all that you do. Thank you to the nurses that are on this webinar. And thank you for doing the best. And that's what we're here to celebrate. So thank you. Thank you so much.
Wonderful. Thank you very much, Sarah and Boot & Care. I'm very excited about your Memorial Day celebration. I can't wait to be there. So next up, our next gold sponsor is Skank, Price, Smith and King. And we'll hear from Shirley Whitenack, who co-chairs their elder law and special needs law practice and their estates and trust litigation practice group, along with Regina Spielberg, who's on the panel. So take it away, Shirley.
Thank you very much, Wendy. It's a pleasure to be here with you today. Skank, Price, Smith and King has been a proud member of the Chamber for over 40 years. We are a full service firm, but I'd like to speak with you for a few minutes today about our elder and special needs practice. We have a very robust group here of attorneys and paralegals who assist seniors and their families and people with disabilities in navigating the legal aspects and some financial aspects as people age or as people go through life, negotiating their lives for people with disabilities. So for example, we do estate planning for people who are seniors and their families, as well as people with special needs. We create special needs trusts for people so that they can have assets available to them for their supplemental needs and pay for things that government benefits, such as Medicaid or SSI, don't pay for. For people who have not done the appropriate planning, we do guardianships and conservatorships. We also help people to navigate paying for long-term care, whether that long-term care is in the home, assisted living, or in a nursing home. So we make Medicaid applications, VA benefits. We assist in terms of addressing how to find nursing homes and assisted living facilities with the help of geriatric care managers, such as Trish, Colucci, Barbosa, who is your moderator today. And we would be very happy to assist you if we can. Thank you so much for your time.
Terrific. Thank you very much, Shirley. And both you and the NJ Elder Law group really provide a valuable service. I just don't think people understand the importance of working with ACELA, and we'll hear more about that when we have our panel. I want to thank our silver sponsors, Unicity Healthcare, Homewell Care Services, Arbor Terrace of Morris Plains, and Care One. Thank you. We really couldn't do this without your help and your support. And I won't say it keeps the lights on, but it sure does help. We're a not-for-profit, so thank you very much. I'd now like to introduce our moderator, Trish Colucci Barbosa, President and Principal Care Manager of Peace Aging Care Experts. Trish started her company more than 14 years ago, and she and her staff have assisted hundreds of families. I've known Trish for many years now, probably since 2010 when I first started in this field. I think we met and we've been connected ever since. She's been a great mentor for me. I've learned so much from her. And she has her elderly father living with her. She has a special needs adult child. I mean, she has walked the talk. So thank you, Trish. I really appreciate you moderating this panel for us again today. Take it away.
It's my pleasure. Thank you so much. So I have the pleasure now of introducing our panel speakers today. I'm starting with Eric Goldberg, who is a certified elder law attorney. He's a leader in the tri-state area, not only for advocating for seniors and their families, but also for being a customer-centric law firm. Eric has a diverse background. He's worked on Wall Street and now specializes in estate planning and protecting families against long-term care costs. Our next panelist is Regina Spielberg. She is also a certified elder law attorney with the firm of Skank, Price, Smith and King. Regina co-chairs the Estate, Gift, and Charitable Planning Practice Group at Skank Price, certified as an elder law attorney by the ABA Accredited National Elder Law Foundation, and an accredited estate planner by the National Association of Estate Planners and Councils. Gina assists seniors, people with disabilities, and their families in connection with a variety of legal issues, including elder care, special needs planning, and the planning for incapacity, with an emphasis on promoting the best quality of life for individuals. Next up is Wayne Morgan. He's the Vice President of Development of Homewell Senior Care Services. Wayne is the Vice President, he's been with Homewell since 2017. Prior to joining Homewell, he served and developed programs for youth and families within the juvenile justice system for 7 years. Homewell is a leader in the home care industry committed to raising standards, consistently evolving, and introducing specialized programs and services to meet the emerging needs of our clients and community. And bringing up the rear, certainly last but not least, is Rita Grandelis, the Director of Geriatric Care Management at Unicity Healthcare. As the Director of Care Management, Rita has over 20 years of experience as a licensed clinical social worker in the geriatric field. She earned a master's degree in social work from Adelphi University in Garden City, and her bachelor's degree in psychology is from SUNY Cortland. Before joining Unicity, Grandelis served as the Director of Social Service for a 110-bed subacute and long-term care facility. Prior to that, she worked as a social worker in various healthcare settings, including home care, acute care, subacute care, and long-term care, and also as a clinical liaison for a large healthcare company. Rita's vast knowledge of home care, facility care, and community resources are a tremendous asset to Unicity and their families. So we're going to get started, get all my panelists up and ready, and we're going to start kicking out the questions. Is everybody ready?
I'm here.
Are you good? Oh, there we go. Okay, all right. I wasn't able to see everybody, so I wanted to make sure we were good. So actually, we're going to start ladies first. Regina, you're up first. What do you think are the most common mistakes people make when planning for long-term care? And why is it so important to have a certified elder law attorney in your corner?
Thank you, Trish. I think that the name of this program today really kind of sums it up. I think the biggest mistake people make is waiting too long to do their planning. So everybody is different. Every client who comes in is going to have different needs, but waiting too long is a common theme I see among people. For example, if we are looking to do just documents, powers of attorney, healthcare directives, maybe trusts, depending on what the need is, if people wait too long, their loved one may lose capacity to sign documents. Then we are in the area of having to go to court for a guardianship, which costs thousands of dollars. It's a, really an intrusive way of getting legal authority to help people make legal decisions. And these guardianships in many cases could have been avoided if people had done a power of attorney and a healthcare directive, naming people to assist them with their finances and their healthcare decisions. In addition to that, I think that another mistake people make is listening to their neighbor, because as I said, everybody's situation is different. So, you may have a neighbor who tells you, oh yes, I have a child who has disabilities and we were able to give everything to the child. And then you think you can give everything to your child, but you can't, because there are certain standards that Medicaid is going to look to enforce before they will, as an example, pay for any long-term care. And sometimes people think we'll just give our money away and then we'll get Medicaid. And that doesn't work unless you don't need any assistance for at least 5 years. But there may be other things we could have done. We could have, looked to a deed, looked to annuity planning. There are a lot of things we can do. People also sometimes, and we're going to get into this a little later in the program, confuse Medicare and Medicaid, and they think their Medicare is going to pay for a nursing home stay. And that is not going to happen. Medicare doesn't pay for any long-term care costs. So it's very important to talk to people who know what they're talking about and to do your planning as early as possible. You don't want to be in the situation where you are you know, in an emergency crisis, and I'm sure Eric will say the same thing. I can't tell you how many times I get calls from the children who say their parents are in a nursing home, they're getting rehabilitative care. And the nursing home just told us on Tuesday, Medicare is going to stop paying. Oh my goodness, what do we do now? I can't bring them home. I can't care for them. I have a full-time job. Mom isn't well enough. We're not prepared. And that's the biggest issue that I think my clients face. Eric, do you agree?
Regina, very well said. And I do agree. I mean, you covered it so well. I do want to expand on some of the things that Regina said. When you said listening to your neighbor, what I find very often happens is individuals are listening to the wrong professionals as well. So they might listen to their accountant, who is very well versed in the area of accounting, or their financial advisor, money manager, or the individual who handled their divorce or real estate transactions. I'll give you an example of what we hear. Now, I'm not sure if the accountants are wrong or if people are just hearing what they want to hear, but we're consistently hearing about the $15,000 per person per year gift, which is a gift tax rule. It is not a Medicaid rule. So if people come in and say, well, my accountant told me years ago that I can give away $15,000 per person per year, and so that's what I've been doing. And by the time they get to us, they've given away over $100,000 and now think that that was an okay transfer for Medicaid purposes. Now, I'm not going to get into the nitty gritty where when we talk about transfer penalties and the penalty divisor, but suffice it to say that $100,000 could potentially be a very expensive mistake. And as we all know, when parents give money to their children, that money normally disappears. Their children need it for their children's college education, or to pay for a vacation, or a renovation in a house. Another issue that we see all the time is people staying home too long. Now, I'm a big proponent of aging wherever somebody wants to age. And very often what happens is, and Wayne can speak to this later, is that people promise their parent that they will stay in their home forever. And it's a great thing if they can afford it. And I'm sure Wayne sees this all the time, that all of a sudden they turn around and there's no money left. Either they've exhausted the reverse mortgage, or they have no money left. And now guess what? Their only option is very often a nursing home. So these individuals have decided, I'm going to age in my home, which is the most home-like setting you can imagine. And they end up spending their final days in a nursing home, because in New Jersey, for instance, assisted living facilities very often require 2 years of private pay. So assisted living facilities are a home-like atmosphere. Thus, they miss that one step and go directly to a nursing home. But Regina, very well said, and I just wanted to add a couple more things. Regina, why don't you talk a little bit about about CELA, because I think it's really important. I know I just asked you a question as you started choking. Okay.
So sorry.
And I'm not the moderator. So.
Thanks, Eric.
That's why I'm not the moderator.
That's me.
Okay. Yes, I can do that. So CELA, Certified Elder Law Attorney. When you see that as a person who's looking for assistance in elder law, you should understand, and you can find this on the National Elder Law Foundation website. What it means to be a CELA is that you're in practice for at least 10 years, with the focus of your practice being elder law. You have to provide specific information, not names, but numbers, on the number of elder law matters that you've handled. And not just I've handled elder law matters, I've done powers of attorney for 10,000 people. No, it's a very complex grid, and you have to show that you've helped people with legal authority over finances, perhaps help them with tax issues, help them with long-term care planning, Housing, as Eric said, what's an appropriate housing for somebody who has dementia or is in need of other care? Have you done guardianship? So it's a broad spectrum of matters and types of matters that you have to show a certain proficiency for. In addition to showing that your practice over a period of time covers a broad spectrum of elder law matters, you have to take a test, and it's a very exhaustive test, and you have to recertify every 5 years. So you have to continue to maintain your practice in the area of elder law. You also have to, there are some other smaller qualification issues. So the idea being that if as a client, you are looking for someone with expertise in elder law, you can see a CELA or Certified Elder Law Attorney designation after the person's name. You know that there has been an objective determination that this person is proficient in the area, the many areas of elder law.
Mhm. Thank you. Thanks, Regina. You know, I will say that as a geriatric care manager myself, I've had clients who have been to attorneys who are not even elder law attorneys. And I've seen a lot of mistakes made by some very well-meaning attorneys, especially in the area of trusts and Medicaid planning. So I would say it's worth the investment to pay for someone with the CELA certification because of all the reasons you just explained. Like it's not an easy certification to obtain, to earn, or to keep. So thank
And
you
Trish,
so much.
to that point, I must tell you, and I'm sure this is true for Eric too, clients come to me very often. They've just done a power of attorney. It doesn't have all of the powers that we need to do Medicaid planning. They've paid for it. They've paid for a trust. They've paid for a lot of advice, paid a lot of money for. And I have the sad duty to tell them, we have to redo the power of attorney. Thank goodness your parent still has capacity to sign it. Or I'm sorry, your parent doesn't have capacity to sign new power of attorney, but the gifting provisions in your power of attorney are not sufficient for us to do Medicaid planning. We have to go to court and get permission now and do a guardianship. These are not conversations that I enjoy having because people end up spending double the amount of money that they might have had they gone to somebody who is qualified.
Right, terrific. Well, I'm going to bring a new voice into the mix. Rita, it's your turn. Tell us about geriatric care management and how the role that a geriatric care manager can play in helping families manage the care of their loved one.
Absolutely. First of all, I want to thank Wendy and the Morris County Chamber for inviting Unicity Healthcare to speak today. It's my first time. I'm excited. So yes, geriatric care management, also known as GCM, as Trish and I kind of probably are used to the lingo a little bit more in the field, is a rapidly growing service that offers very personal assistance and ongoing support to the aging adult and the senior and their family. Geriatric care management offers high quality care to our clients who need very personal, very thoughtful care planning to manage their needs. And by helping coordinate the services, we are able to reduce stress for our clients, their family, and their caregivers. So a lot of people will ask, what exactly is a geriatric care manager? Well, a geriatric care manager is either a registered nurse, a social worker, a gerontologist, a psychologist. Sometimes I've seen physical therapists and occupational therapists be care managers as well, who have extensive experience in working in the field of geriatrics and an extensive knowledge of nursing, social work that allow us to assist and support our clients' aging life goals. So geriatric care managers are normally licensed clinical social workers, registered nurses, and in addition to our licensures for our profession, we usually then also have additional accreditations such as being a certified care manager through the National Academy of Certified Care Managers, or being certified through the Commission of Care Managers. And most of us also are certified dementia practitioners. A geriatric care manager can help in a lot of different ways, but really we're there to help provide the guidance and education needed to navigate a difficult situation, alleviate stress, improve the quality of life for the client and our family. And really, we save time away from work for that loved one and their caregiver who spend a lot of time dedicating, caring for their loved one. So we're able to kind of jump in, be their advocate, be boots on the ground, and it saves the family and or the caregiver stress and time away from work and their family. So a geriatric care manager is a great resource for the aging adult and their caregivers. We take a client-centered approach, meaning we look at the client individually, not just by their diagnosis, and kind of take a holistic approach to looking at their care. And then from that, we create a care plan. We assist with anything regarding their physical, mental, emotional, medical, and social challenges. We are there to be our client's advocate. We develop a care plan that is constantly changing and can be reassessed as needed to address such things as, do we need care in the home, private caregiving? Do we need medication management? Housing issues such as possibly aging in place in their home, but then doing a home safety assessment to making sure that's an ideal place for them to age. If it's not, then transitioning possibly to an independent living, an assisted living, a memory care facility, a residential care facility, obviously taking into account their financial needs as well. That affects where we can place them and what resources and services we're able to provide for them as well. Financial planning, looking at their assets, really kind of realizing what money they have and planning for that. Legal referrals to wonderful attorneys like Eric and Regina to really do that planning for the long term, making sure their legal documents are in place, as we talked about, a power of attorney, a living will, the post form, a regular will. We do client advocacy, advocating for our client, whether they're in a skilled nursing facility, whether they're at home, whether they're in an assisted living community, making sure that their needs are being met on every level. My team consists of registered nurses and social workers. So my nurses are able to do medication management, which is a big piece of the puzzle for a senior living at home, is really reconciling the medications and ensuring compliance, especially if they've just been discharged from the hospital or a skilled nursing facility or an acute rehab. Little things just like creating a great medication management program or medication compliance can prevent an ER admission or an unnecessary hospital stay. We are community resource referral. I mean, it's education of the resources and how to access those resources in your local community. We do crisis intervention, critical thinking, problem solving. We are all care managers, pretty much accessible 24/7. As Trish knows,
That's the truth.
We've all gotten that call at 3 a.m. We're really boots on the ground for most of our clients. A big crux of what we do is a lot of complex medical care management as well. Caregiver education for either a private caregiver and or the family. So really, as a care manager, you wear many different hats. And it's not necessarily just for the older adult and their senior. And Trish can attest to this, I'm sure, as Eric, Regina, and Wayne can as well, that we're seeing it shift to a younger population as well. There's a lot of younger adults who are facing a lot of chronic health issues that, are ongoing and need that care management guidance as well, whether it's due to a physical disability, a traumatic brain injury, mental health issues, developmental disabilities such as an autism or Downs. So I think we're kind of even going away a little bit from the geriatric or senior term, because all of us, I know I have a client, my youngest is 29. So, we're kind of gearing away from just working with seniors, but the thought process is the same for what we do.
Well, thank you. And before I shift over to Wayne, tell the folks about our wonderful professional association, the Aging Life Care Association.
Absolutely. So geriatric care managers really in our world too are known as aging life care professionals. And those of us who are aging life care professionals are members of the Aging Life Care Association, which is a wonderful organization that connects us all nationally. And there's different levels that you can have of membership, and it's based on certification and expertise and years of experience. It's a great resource for families if you're looking to locate a care manager in your particular location. And we as care managers use each other as resources and information sharing through a listserv that we have if we're referring clients as well to other locations, or even if it's in our location, maybe asking about a resource or whatnot that we may not know about. So it's a great organization for families to utilize if you're looking for a care manager in your particular area, and even for care managers to use as a professional connection, as well as knowledge, and information sharing as well.
That's terrific. Thank you so much. Thanks for
You're
describing
welcome.
what you and I do every day.
Oh, it's so hard to describe, but I
It is.
tried.
It's not an elevator pitch. It's not. It
No.
always takes longer. Wayne, I'd like to bring you in now as the owner of a home care agency. Can you help us to understand, help the audience to understand, what's the difference between hiring a home health aide through your agency or hiring somebody that you meet at a church or that you get through a friend, just hiring that person privately?
Yeah, of course. Thank you, everybody. First and foremost, thank you, Trish. Thank you to the Morris Chamber. Thank you to the panelists. It's an honor to be side by side with you to educate the community and the attendees. So thank you, everybody, and love to answer that question for you. So we do, myself along with my my colleague Jen, and the rest of my team, we do get a good amount of calls, daily, weekly, of families in need of a home health aide or considering an agency. And most do say, I have a friend of a friend or a cousin who's maybe a retired nurse, or I was on Craigslist, I was on Facebook, and now there are what's out there called like registries. So the first thing that I always try to present is for myself, my nursing team, my client relations team, to sit down with a family, give them a voice, listen to them, to explain the benefits of having an agency. And it is a complex, situation. It usually is in a crisis mode. So it's understood on why they're exploring agencies, but also reaching out to families. So what I do my best to encourage and explain is that, the agency is the employer. You want to ensure that the agencies such as ourselves and many reputable agencies out there are licensed, bonded, insured, and now even accredited. That's very important. The agency will attain, workers' compensation, liability insurance. They'll handle the withholding of all state and federal taxes. Even through an agency such as HomeWell and other agencies, it can also be a tax write-off for the client and for the family. The agency will also perform, a vetting process, a hiring process when a caregiver comes through the door. That vetting process, what that does is it includes a comprehensive, complete background check, a drug screening, verifies the caregiver certifications, their experience, their skill sets, ensures that there's no flags on a caregiver's license. So I always frame it, a caregiver does have a license. It's somewhat similar to like a driver's license. You have a point on your license. So the caregiver, unfortunately, if wasn't following the right direction, maybe violated, a task under a registered nurse, there could be a flag on that license. Agencies will perform multiple interviews. When that caregiver is on service, they're employee of the agency. They're constantly getting training, so they're getting upkeep with their skills. In addition, the agency will then also manage the scheduling of the caregiver. So there's backup at all times. If there's a call out or an emergency, the agency is going to communicate with you, discuss, maybe what transpired, why the caregiver isn't there, or the emergency, and have your back and schedule those open shifts for you. If the caregiver happens to not be the right fit, whether it's skill set, personality, Mrs. Jones is tough, she's stubborn, she's very independent, she's strong-willed, it could be a personality piece. The agency is going to work with you, listen to you, have a conversation, and work with you on making a switch, make the right clinical match, make the right personality match for the client, and also for the family. Along with all those great benefits, the agency will also provide 24/7 support through all departments. So an on-call support that's 24/7, whether it's billing, scheduling, nursing, or more or less just having a question. But most importantly, it's through a registered nurse. So through a licensed, a private home care agency, a registered nurse is involved with creating a care plan, with supervising the home health aide, with ensuring that the caregiver is going to follow the tasks that the care plan includes. Those tasks are being met. The registered nurse is going to offer training on site, in the field, and always be available to our families and clients for additional support and questions. So understanding and knowing that you're getting not just a highly trained and skilled caregiver and a customized plan, but you're receiving the benefits of a registered nurse overseeing the home health aide clinically and overseeing any change of conditions or needs that are in the home. And then lastly, we do work with long-term care insurance policies. So sit down with the family, go through the policy with them, identify that they can open up a claim, and they can actually, most of our clients do spend a good portion of time and money to, invest in these policies where they can take advantage of their benefits. Most insurance policies now are seeking, their clients to secure a licensed agency. So, having a policy in place that did cost some money and still does, you want to be able to, open up a claim, take advantage of home care, along with any additional services that policy does include. So there's tons of benefits. I can continue to go on, but it's really, it's making sure they're licensed, bonded, insured. You're taken care of on the back end in terms of recruitment, hiring the right person, making sure it's the right skill set, the right personality home, having that 24/7 support on the back end. And of course, if you have any additional resources that can help you financially or even in the community, we're here to help you as well.
That's great. Thanks, Wayne. As a care manager, I get calls, and I used to work in home care many moons ago, and families would call and say, oh, I need a home health aide for my mom. How much will Medicare pay for? Right? That's a tough discussion because we know Medicare doesn't really pay for home care. Can you give us, just explain to us the difference between hiring an agency like you and a visiting nurse agency, which is something that is covered by Medicare? Just help us understand the difference of what the two types of agencies provide.
Yeah, of course. This is my favorite question because it's probably every phone call because those Medicare visiting nurse type services are still out there being called home care, or my type of service be considered home health. And there's confusion. And unfortunately, some insurance companies will actually tell a client or a family, well, mom and dad or grandma and grandpa is awarded, let's say 35 hours a week, and they call and they're very excited, and it's a tough conversation to have with them, and it's education. So to answer your question, a visiting nurse type service is covered through Medicare. It could also be covered through a private insurance. It has to be ordered through a physician for this service to be implemented. Those services provide what's called skilled care. Skilled care could be such as nursing, physical, occupational, speech therapy, can possibly provide a social worker or even a home health aide. And this care is considered short term. So they do send a nurse to the home. That nurse will do an assessment that's going to determine the frequency of those additional services in-house. It could be a few times a week for maybe just an hour or so of visit for maybe on average 3 to 5 weeks. So there is a benefit to it because of the skilled nursing piece, of course, the physical, occupational, speech therapy, a social worker who's going to come in with a wellness approach, and a home health aide who's really going to come in and help with the bathing aspect and dressing. So there's many differences with the services we provide, but there's also benefits and differences where we can supplement each other. So our type of services is considered non-skilled, and that's non-skilled care through highly skilled certified home health aides. And our type of services can help up to 24 hours per day, 7 days a week. So non-skilled, and with what a certified home health aide can assist with, is a wide range of things with daily living activities such as bathing, clothing, toileting, helping with med management reminders, light exercising and stretching. So working with that visiting nurse, physical therapist in the home, doing those exercises and stretches on the off days to continue a routine, continue to get a client independent and improve their strength. Assist with maybe transportation, running some errands, going to a follow-up physician's doctor's appointment, or outpatient therapy, or maybe a walk around the park. We assist with meal preparation. We can cook meals, linens, laundry, light housekeeping, companionship, life enrichment. It's really that form of support, a personal assistant who's going to help on a personal care level, but also on a custodial care. So there's many differences, such, there's what we do. But again, we do supplement each other. And there's a lot of really, really good, visiting nurse services out there that do now have specialized programs. So they're really focused on preventing hospitalizations or unnecessary visits to the ED, fall prevention, speech therapy. These are great resources to have, especially for those who are coming home from a skilled nursing facility to a hospital, or maybe they're home and they're weak and they have someone like myself, a geriatric care manager, an elder law attorney, where we can educate them on this process and say, when was the last time you saw your primary care physician? We can get that order in and we can implement these services. So those specialized programs are extremely important in terms of what's going on within our industry. And it's specifically for our sake, Homewell, we have specialized programs to prevent readmissions, fall prevention, life enrichment. So there's many differences, but it's always encouraged to have both of these services in the home.
Right, great. Well, thank you so much. I'm going to bring things back to Regina
Thank you.
for a minute. We're going around full circle again. I know that this is a big topic, Regina, but can you explain briefly what the importance of well, mostly Medicaid planning, but also how Medicare plays in that too, for someone who's aging?
Yes, and I think that Wayne's explanation of the difference between the visiting nursing care that is paid by Medicare and a home health agency, which is not paid for by Medicare, is a good segue into this topic. So Medicare it's an entitlement program. If you have paid into Social Security for 40 quarters or 10 years, but it doesn't have to be consecutive, you automatically qualify for Medicare Part A at no cost when you turn 65. If you are disabled and you're under age 65 and you're getting Social Security or railroad benefits, disability benefits, you're also going to be entitled to get Medicare after 24 months on the Social Security disability. If you have ALS or end-stage renal disease, you can get your Medicare immediately. You don't have to wait the 24 months without paying. So, and there are other ways to access Part A if you don't have your 40 quarters. I don't want to spend the time going over that, but that is available. You do not have to meet any financial eligibility other than having paid into the system, or the other things for people who haven't paid into the system who end up paying for Part A. But Medicaid, on the other hand, is a means-tested benefit, and you have to qualify both clinically or medically and financially. And it's really a poverty program. So as Trish says, planning for Medicaid early is important. You don't have to plan for Medicare as much because the qualifications are much simpler, more straightforward. You just have to make sure that you take your Medicare when you're entitled to it, or you might end up paying a penalty. Medicare will cover, it's more like traditional health insurance. So it will cover if the person has had a 3-day admission to a hospital, and then subsequent to that needs rehabilitative type care, the type of care that Wayne was talking about, which is the speech therapy, physical therapy, occupational therapy, those types of therapies. And they're given in a nursing home setting. Those are rehabilitation centers at some point. And Medicare will pay up to 100 days. The first 20 days, Medicare Part A pays in full, and days 21 through 100, if you're lucky enough to get them, there's a copay, which I think is $185 or thereabouts this year per day. Most people don't get the full 100 days because Medicare will only pay as long as the person needs that skilled nursing level of care. That's the physical therapy, the speech therapy, occupational therapy. Once the nursing home perceives that Medicare is no longer going to pay, the care changes from being rehabilitative to being custodial. That is the point. Medicare is not going to pay any longer. And typically, if Medicare doesn't pay, then your supplemental Medigap policy is not going to pay. And at that point, the nursing home, the care team is going to come to the family and say, now you have a decision to make. You can take your loved one home, or you can let them stay here at the facility as a long-term care resident. That is a medical decision usually for the family. Are they able to care for the person well at home? Maybe with an aide, somebody from Wayne's organization or from Unicity. But if they are not able to provide that care at home, is the person going to stay long-term? And do they have the money to pay for the care? Nursing home care, as we know, is not cheap. It's probably about $13,000 on average in New Jersey per month. And home care is somewhat less, but not always, depending on whether you need round-the-clock care or how many hours you're using. Once the person qualifies financially for Medicaid, which means they do not have more than $2,000 of countable resources in their name, and the house doesn't count, they potentially can qualify for Medicaid. There are very complex eligibility rules. You cannot give away your money and qualify for Medicaid immediately. There is a 5-year look-back period most people are familiar with. There are some techniques that we can look to do, perhaps make a gift and some annuity planning, or if there is a child with disabilities, we may be able to do something. There are different things we can look at. One of the things that I am concerned about as I listen to Wayne speak, this comes up all the time, is that people do stay at home, as Eric said, for a long time or as long as they can, and they may be privately paying people. And everybody should know that the IRS indicates that a home health aide is an employee. You saying they're an independent contractor does not make them an independent contractor. The IRS is very clear about this. As a result, you have certain employment obligations to meet. Over and above that, if you have been paying people off the books, when you are producing your documentation for Medicaid, which includes 5 years of all of the financial statements that you have, and there is money going out of the account in cash, we have to provide an explanation for that. And if the explanation is, I've been paying a home health aide off the books, well, Medicaid is going to want some proof of that. They know the money is going out, and you might have been paying somebody because they are not documented. They're not going to sign an affidavit that says, yes, I have been working for this family for the past 5 years providing care. They're just not going to do it. So those payments to Medicaid often look like gifts or transfer that are eligible for penalty. So we spend a lot of time trying to document proofs that that is not the case. So planning for Medicaid as early as possible, at the beginning of a diagnosis or when you hit a certain age, it's crucial. And frankly, everybody at any age should have powers of attorney and healthcare directives in place. As as Sarah was saying, Rita was saying, sorry, that you're seeing more and more younger people with traumatic brain injuries or other reasons that they need assistance. Well, they may need assistance with finances, so they should have powers of attorney and healthcare directives to help for medical decision-making, or we're going to end up in guardianship land for them too.
That is a perfect segue, because I just dipped into the Q&A and I want to hit Eric up with this question. Andrea wants to know, if a parent doesn't want to sign the documents, and I'm assuming she means power of attorney and advance directive, what is the family supposed to do? Now, I know that this is probably a very unique situation that you never see happen, but I'm wondering if you could dig back in your experience and give some advice.
I do see it happen. And very often when it does happen, first of all, we have to make sure, and Trish, we've gotten you involved in these cases where maybe mom needs to be assessed. Does she have capacity? Is she a danger to herself? Is this a possible guardianship possibility? Otherwise, what I tend to do is say, you know what, bring her in here and let me have a discussion with her, because very often what happens is parents look at their children, still their adult children, as children. Or if they're starting down the road of dementia, there's some paranoia or confusion. And so they have an independent third party, they have an attorney. People of that age very often highly respect the legal profession. So they look at me as an objective professional, and I can explain to her exactly the importance of this and maybe do a little bit of fear mongering. I had a case like this years ago where a gentleman refused to sign a power of attorney. And what I finally, after 2 or 3 meetings with him, convinced him to sign what's called a springing power of attorney. I don't like to do that, because I'd rather have what's called an immediate power of attorney, which allows an individual to act immediately without having to prove the grantor's or the principal's incapacity. But we kind of edged him into this and pushed him into the springing power of attorney. And lo and behold, only 2 or 3 years later, we needed to use that document. So there's really no panacea for this. There's no magic bullet here. Every family's different and every conversation's different. And sometimes, unfortunately, it requires a crisis to convince the individual.
Mm-hmm. I would even say that I've had situations where I always say to families, you know, there's a parent-child relationship like what you had just talked about earlier. And it doesn't matter if the child is 70 years old. You're still my kid. You don't tell me, I tell you. So, and oftentimes having somebody objective coming into the situation, whether that be the elder law attorney or a geriatric care manager, the same advice that the child gave can also almost have completely new meaning and make so much sense. So that might be a workaround, Andrea. We just have really less than 10 minutes here. So what I wanted to do is just kind of go around to all 4 panelists. We'll start with Rita, and just give us in 2 minutes or less, tell us why it's so important to engage with someone who does what you do before a crisis occurs. So Rita, you're on.
Thank you. It's for our knowledge and our expertise. We're trying to prevent a crisis. We're trying to prevent the situation where emotions are running high. So if you have a care manager and the appropriate team of support already involved to age in place, it'll make the whole process smoother for the senior, for the family, and for everyone involved. So crisis prevention is the goal for all of us, and to make sure that our clients are safe, both physically, emotionally, and mentally. So having that care team involved before the crisis is obviously the best thing. But even we do get involved in crisis, you know, we can still see through that step by step. But for everyone, if you have the appropriate village of support in place beforehand, it'll just make all the processes that much easier as you go through the stages of aging.
Wow, terrific, and way under 2 minutes. I think geriatric care managers, home care agencies, and elder law attorneys are all a perfect fit. They all do different things, but all work cooperatively to support the clients. Wayne, give us your 2-minute pitch on how home care can help avoid a crisis.
Absolutely, and I think Rita and yourself really summed it up. It's the preventative care. It's working with professionals such as yourself and present us as a team to, you know, form an interdisciplinary team. But it's really important for a home care agency to listen, to understand the previous history, clinical history, to the needs in the home, get to understand the client for who they are. They're people, and we're mostly working with adults or seniors who've had, you know, a tough maybe road, or families that are, you know, going through a tough crisis as well. So our job is to really understand the client for who they are, the family for who they are, what the needs are, ensure that our nursing team clinically has all the records, that they're caught up understanding what the needs will be in the home, ensuring that our caregiver is highly trained, skilled, because that is a huge decision for a family and especially the client to make with a stranger like myself, talking about putting a stranger in their home. Build that trust level and be empathetic, but also present to them, you know, tell me about mom and dad and how can we help, and not to go into a care management approach, but really identify the needs and think of the elder law attorneys and the geriatric care managers, the resources that can be in the home. So when we make plan A, plan B, and plan C, and God forbid there is a crisis that occurs, we understand that any of these plans that we discuss is a win for everybody, and that you have your team behind your back. And that's what home care really approaches. It's the right quality of care with the right skilled caregivers in the home, but yet understanding that you have a leader and a resource behind you, whether it's the agency or who the agency works with.
Terrific, thank you. And Regina, how about you?
Okay, I liked what everybody said, because I think that the interdisciplinary approach is very important in this area. I am always referring people to geriatric care managers and home health agencies, because it's not an area that I can help in except for do the referral. What I can help in is to help people organize their finances and organize a way that there is decision-making available if something were to happen, if a crisis is to occur, their lives can continue in a way that will help them and their families ease into the process. This is not an easy area to address. It's difficult for people to think about a time when they may not be able to handle their own situation anymore. And when people come to me, we walk through this process. We counsel on each of the roles that might be played. An agent under a power of attorney. What is the skill set that that person needs to have? And we talk through, what does a healthcare representative have to do? It isn't necessarily, I'm going to choose my oldest child in all of these roles. You have to choose a person who can stand up in a hospital situation, make difficult decisions at a very difficult time. So walking through all of those alternative decision makers with the person, I feel that it helps to ease things and takes a bit of the worry away from them once their documents are done, once we've looked to see, is there money that can be put aside for you somehow? Is there something we can do that we're not spending all of your life savings, whether it's $100,000 or $100 million, on your care? So I like to think I help people by relieving their worries about a very difficult time for them.
Thank you. And Eric, I'm going to give you the very last word.
Great, thanks, Trish. Yeah, I mean, I can sum it up. I echo exactly what Regina said. Elder law attorneys are usually individuals who are attracted to this area of practice. They're unlike other attorneys. They're usually empathetic. They're often very approachable. And we have in our area, at least, this incredible network of elder care professionals. I love the people that I work with, and talking to geriatric care managers and home care agencies and the people who work in assisted living facilities. And, for an elder law attorney, it's not just about the documents. We prepare these incredible, important documents: wills, powers of attorney, healthcare directives, trusts, and we're planning for people. And what is all this doing? Yes, we are trying to avoid the financial devastation that comes with a long-term care need, but really what it ends up being is we're providing peace of mind. And one thing that struck me before when Regina was talking about hiring undocumented workers instead of a home care agency, well, say that we don't do any real legal work for them, or they came to us too late to do legal work, whatever, we find that they're about to hire an undocumented worker, somebody paying somebody under the table. We can prevent so many future problems for them just by having us on their team and guiding them, and then maybe referring them to some wonderful professionals like the people on this panel. So it's a gratifying profession, and I think it's just so important to align yourself with the right people.
I always say elder law attorneys are a special breed. Yeah. I really, really are. Anyway, I'm going to hand things back to Wendy now. Is Wendy hanging around out there?
I certainly am.
Okay, I deliver you
There
2
she
minutes.
is.
Thank you, thank you. And I have to echo what you're saying. I really do feel that elder law attorneys are very special. You really do have a unique niche that we so need, and that's why I just stress that, go to an expert, go to Rita to get some advice, or Trish, as far as just in general geriatric care management. Wayne, get educated on how much will it cost if my parent does need this type of care. Do that planning, because you just don't want to do it in a crisis, which is really why I pulled this panel together today. And thank you, can't thank you enough for your time. We heard a lot of great information. Touch the surface, really just touch the surface. So it's important to do your homework, reach out to any of the panelists to get some more information. Everybody's information is in the chat. If you don't know how to save the chat, it's the 3 little dots in the corner there next to where you actually type. So just click on it, save the chat, you'll have their information. I did want to mention we have 3 more of the 6-part series coming up on July 20th. We'll have a great panel on downsizing. Okay, that's a big task. So we have a lot of great experts in that field. On September 9th, we have Medicare, Medicaid, so we can get a little more in depth in that. And then rounding it out in November with brain health. And, you know, we'll have Alzheimer's New Jersey, Alzheimer's Association, and an expert in nutrition on brain health. So I'm very excited. Stay tuned. Thank you very much, Trish and the
My
panel.
pleasure.
And have a great week, everybody.